talk on complication and sequelae of tuberculosis. So, complication and sequelae of tuberculosis, a clinical perspective. Introduction. Tuberculosis TB remain a major global health concern, not only due to its active disease burden, but also because of its long-term consequences. While many patients recovers from TB, a significant number are left with complications and sequelae that impair the quality of life and may lead to chronic disability. So let's start with the definition and importance. Complications. Problem that occurs during the disease course or treatment. Sequelae. Long-term consequences after the infection has resolved. Emphasize why it is important to recognize and manage this condition. Prevention of chronic respiratory disability, relapse or death, pulmonary complications. First is a hemoptysis. It's a life-threatening condition when it is a massive, caused by the bronchiectasis, racements aneurysm, residual cavities. Second is a bronchiectasis, dissection of bronchial wall. It causes recurrent infection, productive cough. Third is a pulmonary fibrosis and cavitation, permanent scarring, volume loss of lung, dyspnea or breathlessness, restrictive lung pattern. Fourth is a chronic respiratory failure, especially in post-TB destroyed lung, requires long-term oxygen therapy in some patients. Fifth is a aspergilloma, that is a fungal ball in TB cavity, can cause chronic hemoptysis. Sixth is a airway stenosis and bronchial obstruction, often due to endobronchial tuberculosis, cause localized atelectasis, recurrent pneumonia. So let's talk about the extrapulmonary tuberculosis complications. First is a TB meningitis sequelae, hydrocephalus, stroke, cranial nerve palsy, cognitive impairment. Second is a spinal TB, that's a POTS disease, kyphosis, spinal deformity, paraplegia. Third is a TB lymphadenitis, sinus formation, scarring, renal tuberculosis, style pyuria, calcification, renal failure, genital tuberculosis, infertility in both men and women, pericardial tuberculosis, constructive pericarditis, chronic heart failure, chronic heart failure symptoms. Now, systemic and drug related complications. Malnutrition and cachexia, common especially in multi-drug resistant TB. Second is a hepatotoxicity due to anti-TB drugs. Monitor liver function regularly. Third is a peripheral neuropathy. It could be because of isoniazid induced and now linozolid induced also. Pyroxene supplement is the key. Autotoxicity, especially with streptomycin and amikacin, that is the aminoglycoside. Psychological impact, depression, anxiety, stigma, poor adherence, social isolation. Section 5, post-tuberculous lung disease, that is PTLD. A distinct clinical entity defined by persistent respiratory symptoms or structural abnormalities after completion of treatment. Radiological findings: fibrosis, bronchiectasis, cavities, functional impairments, mixed or restrictive spirometry, need for structured rehabilitation and long-term follow-up. Now, let's talk about the diagnosis and monitoring. Imaging, chest X-ray, HRCT chest, pulmonary function testing, sputum AAB to rule out active disease, bronchoscopy in complex cases, TB PCR for post-treatment inflammation versus active disease. Management strategy. Multidisciplinary care involving pulmonologists, physiotherapists, psychiatrists, pulmonary rehabilitation, surgical intervention, for example for hemoptysis and aspergilloma, oxygen therapy and bronchodilators, psychological support and counseling, vaccination and prevention of other respiratory infection or super infection. So let's conclude, tuberculosis doesn't end with treatment completion. The complication and sequelae can be as disabling as the disease itself. Emphasize early recognition, rehabilitation, and patient-centric care, and with a call for awareness, surveillance, and integration of post-TB care into National TB Control Program. Thank you.